The human body, a marvel of engineering, houses a network of highways known as blood vessels that transport essential nutrients and oxygen to every cell. Sometimes, however, a roadblock can appear in these pathways, disrupting the smooth flow. This roadblock, or clot, can lead to a stroke if it lodges in a blood vessel in the brain. One of the most effective ways to remove such a blockade is through a procedure known as endovascular thrombectomy. In the world of medicine, endovascular thrombectomy is a relatively new player, but has quickly become a game changer, saving countless lives and reducing the impact of strokes. It is a minimally invasive procedure that removes clots from blood vessels in the brain, restoring blood flow and mitigating the damage caused by a stroke. Now delve into the process of this remarkable procedure. The procedure begins with the patient lying on a table, under local or general anesthesia, depending on the patient's condition and the doctor's preference. A small incision, no larger than the size of a pinhead, is made in the groin to access the femoral artery. A catheter, a thin, flexible tube, is then inserted into the incision. This catheter acts as a guide, a pathfinder navigating the intricate web of blood vessels. It is carefully maneuvered through the body, up towards the brain, under the watchful eye of real-time imaging technology. Once the catheter reaches the clot, a device known as a stent retriever is passed through the catheter. The stent retriever is expanded at the site of the clot, ensnaring it within its mesh-like structure. The clot, once firmly attached to the stent retriever, is gently pulled back through the catheter and out of the body, leaving the blood vessel clear and restoring the blood flow. Following the procedure, the patient is closely monitored to ensure that the blood flow remains stable and that there are no complications. The recovery period can vary based on the location and size of the clot and the patient's overall health. Endovascular thrombectomy is a beacon of hope in the fight against strokes. The procedure's elegance lies in its simplicity and effectiveness. It bypasses the need for open surgery, reducing the risk of complications and speeding up recovery times. In summary, endovascular thrombectomy is a minimally invasive procedure that removes clots from blood vessels in the brain. It begins with the insertion of a catheter into the femoral artery, which is guided to the clot. Once the clot is reached, a stent retriever is used to capture it and gently pull it out of the body. The procedure ends with the patient being monitored for stability and any potential complications. While endovascular thrombectomy is not a cure-all, it has revolutionized stroke treatment. It offers a lifeline to those affected, providing a chance at a better quality of life post-stroke. The human body may be a marvel of engineering, but sometimes it needs a little help to keep the highways clear. And for that, endovascular thrombectomy is ready to lend a hand.